Thank you. Good afternoon, everyone. Can you hear me okay?
Yes.
Awesome. It's always great to go fourth and last when you're in these presentations. And Charlie gave me a great topic to talk about as well. It's incredibly narrow. But thank you for the opportunity. And I'm going to take you through a little bit my view on what reimagining orthopedics for the future looks like. But before I do that, let me just give you a bit of background on myself. So I'm Indian born, got raised in India, moved to the UK to study engineering. Did bioengineering at the University of Leeds, and I think for most of you who know the University of Leeds, pretty much 90% of my degree was orthopedic research. So it was pretty much natural transition to move into orthopedics, and I worked in R&D, global and strategic marketing in different companies, stepped out of orthopedics for a while, got back in, and currently heading up the global hip business for Smith & Nephew. My philosophy, so I really believe in innovation, really believe in continuous innovation and data-driven innovation, not just from a product standpoint, but also a process and system standpoint. And I think we talk a lot about product innovation. We don't spend as much time talking about process and system innovation. And if we really start thinking about the disruptive products we talked about today, unless there is process and system innovation, the successfulness of that product gets limited. My philosophy, and this is a statement that one of my ex-chairmen had presented to all of us in a previous company I worked in, is really falling in love with the customer's problems and not the solutions. Because again, I think many times we really fall in love with our own solutions, and we spend a lot of time honing into these solutions, and we sometimes forget what the true focus of our mission should be, and that's really about solving the customer's problems. And then a little disclaimer, it's about reimagining orthopedics. This is a view of reimagining orthopedics. I'm sure between all of the clever minds in this room, there are many other views on what orthopedics will look like in the future. So I'll start with a fundamental shift in value. And I think we've all heard of Michael Porter's definition of what a value equation is in healthcare, and it's all about improving healthcare outcomes and reducing costs in the systems. Ernst & Young a while ago actually introduced a new value equation. This is really about future value in healthcare. And they propose that future value in healthcare is a culmination of innovation, which unlike previously is not purely outcome innovation, it's personalization and really experience-driven innovation, and data. Data being, connecting different dots of data to be able to start seeing data streams, combining the different sources of data in order to get towards predictive analytics, and then finally sharing that data. I think you heard from a number of my colleagues that today we are not transparent enough and we aren't able to join the dots when it comes to data. And because of that, we're slow at getting towards artificial intelligence and predictive analytics. So there are a number of micro trends, the macro trends that are occurring today in the field of orthopedics, and these will really shape and create a framework by which we operate and by which we can innovate in the future. So I'm just going to take you through some of these. So I think we all know that there's a significant shift in point of care. ASCs are in a hyper-growth phase. Over 50% of electives today happening in ASCs, and that number is rising day by day. COVID has obviously accelerated that trend, so this is pretty much a standard thing. You're all very much aware of it. You're also aware that there's a significant rise in consumerism, right? So patients are much more engaged and involved in their care. I don't know if you know, but today up to $400 billion gets spent out-of-pocket expenses on health and wellness by patients here in the US. So significant more engagement from patients, significant more involvement. This was work done by McKinsey where they really looked at, when you look at unplanned high-cost post-operative follow-up and look at the causes for them, 33% of those causes are actually preventable causes. We also know that patients are really kind of driving personalization. So personalization can lead to, and there's enough data today on that, can lead to better experiences, and experiences lead to outcome. So this is yet another data where if you speak to patients who've had unplanned and high-cost follow-up care, they generally score 28 points lower in the Net Promoter Score, and they're 2.2 times more likely to change their insurance company. So one of the things we all to reflect on, we've talked a lot about hard tools and great robots and fundamentally great technology, but in the end, patient experience matters significantly. So how do we really use those tools to drive better patient engagement and patient experience? And then finally, driving choices. We know that patients are getting much more influential, and they're driving choices when it comes to orthopedics, whether that's choice in approach, shifts, choice in being done surgery in ASC versus hospital, and also choice in choosing robotics, right? So I think most of you in your practice, you're starting to see that come through. Smith & Nephew, we do a lot of consumer research on behavior, and this is an exponential data point that shows how much more public interest there's been just purely on Google when it comes to robotic TJA versus conventional TJA. So you've got this incredible flow from patients coming in asking for robotic surgery. And I think there's a huge place for robotics, and we'll talk about that, right? Particularly as you start to move towards further diversity in orthopedics. I don't know about you guys, but I've spoken to a number of female orthopedic surgeons, and let's just say they're not that strong, and they don't like hitting that mallet about 100 times every surgery. So we really need to start thinking about how technology can enable more diversity within this field as well. So talk about robotic adoption. So this is work that was done by Barclays Research Group, and it really looked at how quickly robotics will expand in the next 3 years. And what you can see is purely in THA, and let's be honest, TKA has been faster in robotic adoption than THA, but even adoption in THA is doubling in value in the period of 3 years. And when you ask surgeons what is the main reason why they're not adopting technology and robotics in surgery, it comes down to cost. Whether that's US or Europe, it really comes down to the cost. So more to do from an industry standpoint to develop robotic technologies that actually also provide a health economic benefit and are not significantly adding more cost to the system. And then health tech acceleration. Robotic is certainly one technology that's accelerating. You've heard a lot from my colleagues around health tech acceleration. So I'm going to share some data points with you that I thought were really fascinating. So this was some work that was done looking at venture capitalist investments in the space of health tech in the last 3 years. And what you can see over here is that that investment has almost tripled to 60 billion being invested into health tech today when it comes to venture capitalist investments. And then COVID has obviously accelerated this trend, right? So if you look at the data today, across the period of the last few years, there's been a 3,000% growth in virtual health visits. There's also been roughly about 150 million telehealth claims in this period of the last 2 years. When you start looking forward, prior to COVID, there was only 11% patients who really engage in telemedicine. Today, there's 76% patients who say that they would be more than happy to work in telehealth moving forward. So really a significant opportunity, a significant market space, but needs to be used in a way that allows us to collect the right kind of data, that allows you to make the right types of decisions, and that provides better outcomes for patients. So really more to think about how we leverage the space without adding more cost to the system. And there's a common thread there in that I'll talk about cost to the system because let's be honest, there's significant economical pressure when it comes to medtech as a whole, and I'll share some data points around that. So first of all, if you look at medtech, and this is not just orthopedics, this is across the board, pre-financial crisis and post-financial crisis, most companies' revenues have started going down. The industry revenue has started to go down as we are all under financial pressure. Then you look at COVID, and COVID has significantly added to that, right? So you look at so this was data that was done by McKinsey, and you look at the household financial pressure through the period of COVID. You look at the federal deficit, you look at the state budget pressure, and then correlate that to corporate earning pressure. So now this gap between GDP and healthcare expenditure, which was already going in that direction, has now significantly become wider. So if we don't really think about what our cost of care delivery is and how we reduce that cost of care delivery, and we don't really think about what our cost to serve is, then technology and adoption rates will really get limited, and we'll only be able to serve a small segment of the population. This is another data point which I thought was fascinating. So this was data that was done by BCG looking at cost to serve for medtech and cost to serve for high-end technology companies. So if you look at the blue bar for medtech devices, medical devices, and then you look at the technology devices, and you'll see that the cost for us to serve all of you guys is 3.5 times more than high technology industry. So cost of care delivery is significant, our cost to serve is significant, and if you really want to make orthopedics for the masses, we've got to really consider how we curtail those costs and how we use innovation to do that. And then there's another piece which I think a number of my colleagues mentioned earlier, which is the cost burden of innovation. That has significantly increased. So interestingly enough, companies are investing more and more in R&D. And in fact, the investment in R&D is growing at a faster rate than actual growth in companies. However, that doesn't mean our pace of innovation is increasing. It's actually slowing down. And that's because of multiple reasons. The first is the regulatory pressures, and you've heard about that before, whether that's MDR in the EU, whether that's TJ in Australia or FDA over here. The requirements from a regulatory standpoint has become incredibly complex and expensive to deliver on. On top of that, there's an evidence burden. So again, what is the evidence we need to be able to prove out some of these technologies in order for it to be available for the mass market? And then finally, digital transformation. Every company is going through a digital transformation, and that adds more cost to the system. So ultimately, we're putting more money into R&D. We want to drive innovation, yet the pace of innovation is going to be slowed down because of these multiple factors. Doesn't mean we shouldn't innovate, but it does mean that we have to be very selective and focused on innovation and really ask ourselves, what is the problem we're trying to solve? Is that an actual clinical need for it? And what is the affordability of the innovation that we focus in on? Not talking about affordability in terms of don't innovate because it's costly today, but it'll reduce in 10 years. Sure, you've got to look at economies of scale, but it needs to solve a clinical problem, and it certainly needs to be able to be affordable. So I'm a true believer of Gandhian engineering, and I don't know if you've heard about those principles, but Gandhian engineering really is innovation for the masses. And if you think about how many patients around the world need an orthopedic implant, we've barely skimmed the surface. You guys in the US are probably doing better than any other market, but let's be honest, you go to Africa, you go to Asia, you go to LATAM, most people can't afford the technologies we're talking about today in this room. So we've really got to challenge ourselves and think about how can we make these innovations affordable so that we can impact the masses. So what does that mean in terms of view into the future? So my view is that the future of orthopedics is really around personalized medicine, and it is around being patient-centric. And we know through different data points across the fields of medicine that when you do deploy patient-centric models, you actually see a significant impact in outcomes and experience. So satisfied patients tend to be 36% less likely to actually go into unnecessary visits. They tend to be 28% less likely to switch providers, and 5 to 6 times more likely to actually go back to the same insurance company. So I do believe that personalized medicine is the future, and I do also believe that it has to be around the patient, and we've got to look at the patient experience. To me, that's only able to happen if it's enabled by technology. So there's certainly a room for robotics and digital health to be able to drive and enable personalized medicine. It needs to be powered by machine learning and being able to collect data and that connect, combine, and share data in order to start getting towards a loop back into personalization through predictive analytics. But what I will say, which I think we all need to reflect on as well, is all of that, if we do all of that, we've still got to make sure that we reduce the total cost of care delivery. And that will only happen if we start thinking of innovative ways by which we really look at the care delivery model, we look at the business model, we look at our go-to-market strategies, because today as it is, 10 years from now, if we continue the way we are in processes and the way we actually sell to y'all and not look at those processes, we're not going to be sustainable as an industry as a whole. So really just something for y'all to reflect on. With that, I'll say thank you. Thank you for having me.